Hi, I'm Dr. Lisa Simpson, President and CEO of AcademyHealth. Welcome to our Future of HSR interview series. As AcademyHealth celebrates 40 years advancing health services research and health policy, I wanted to build on that history to look forward at how our field is changing and how we might align our work towards higher impact, more equitable research in the future. In this series, I'll be talking with leaders in health services research, in health policy, and innovation to reflect on where we've been and, more importantly, where we're going next. Today, I'm talking to Dr. Monica McLemore, a public health nurse, scientist, professor, and editor-in-chief of the Health Equity Journal. So, welcome, Dr. McLemore. Tell us about your work. Tell us how you think about research and what its job is.
First of all, thank you for having me and thank you for letting me have this discussion. I try to explain to people that I'm trained as a clinical nurse. I also have degrees in public health, but a lot of people don't understand or appreciate the fact that my PhD is in oncology genomics. I did all of the laboratory work myself. When we were mapping the human genome, right? So all those pipettes, all the Western blots, all of it. So I speak from this place of experience. I have a very unique skill set because I do in science what nurses do in hospitals and healthcare institutions. I speak multiple languages. So I can speak the language of clinicians. I can speak the language of public health. I can speak the language of bench science. And so therefore, it also gives me this very unique standpoint to really think about science and the ways in which we do science. The other thing I will also just add to that is the lives of Black women are complex. And so it requires complex methods to be able to ask and answer appropriate research questions. So for me, my critique of health services research, basic science, epidemiology, nursing science, isn't grounded in hate around any of those things. It's actually deep love and appreciation. But my questions are, and the way that I do my work, specific to reproductive health rights and justice, is really grounded in this notion of the complexity of Black women's lives. And we're not going to get to interventions and or solutions if we don't start centering them in the work. So that's how I think about my work.
So I'd like to build on something you just said, and that is the aspects of how research needs to take on and address racism, not just as a subject of study and explication or intervention, but what about racism and other forms of discrimination within research organizations, our research ecosystem?
A couple of things I would like to say about this. First of all, I write a lot about this because I think the methods that we use, just like whether it's AI or whether it's the scientific method of wanting to observe something, manipulate some variables, follow it across time, write it up, do our analysis. I think inherently those tools have been used in ways that prop up structural racism. But inherently, they're in and of themselves are tools. So that means they can be retooled to bring us more towards health equity. That said, we're never going to get anywhere in any of this if we don't diversify our workforce. I say this everywhere I am. And that's because when you get diverse perspectives and you get diverse ideas in a room, the amplification of what's possible, it exponentiates in ways that we can't understand or anticipate. I worry about echo chambers in science, right? And so for me, one of the things I also think we need to deeply interrogate is how do we start to measure, structural racism? My good colleague, Dr. Rachel Hardiman, who is a longtime Academy Health member and health services researcher, is really hosting some very provocative and interesting questions around how do we even study structural racism? What do we even mean, right? I think we need to bring that creativity back, that curiosity around how do we even begin to wrap our heads around this, which means we're going to need new data sets, right? And I know that makes people very uncomfortable and it makes people really grumpy, but the truth of the matter is many of the existing data sets that we are using need to be reimagined, right? We need to think about what are the variables that we actually really want to be collected. What's a proxy? When I think about it in certain contexts, we use race and racism as a proxy for other things. Similarly, we do the same thing with age, marital status. First time Dr. Julia Career Perry reminded me that when two poor people get married and they have a child, they're poorer. That marriage is not protective for them, right? Because now they got three people who need to live off of two-person low income, as opposed to just two individuals who have low income, right? So we use these as proxies all the time in our statistical models. What are they proxies for? And can we actually get at the variables or the phenomenon that we really want to study? That's one way to upend structural racism in the scientific enterprise. The other is diversification of the workforce. A third is to really think about, well, who are we funding? I have been very happy and excited to see new funding sources around health equity research networks and new funding opportunities where community-based organizations that are led by Black, Indigenous, Latinx folks can be directly funded and subcontracting back to universities. How do we continue to disrupt how we conduct science? Those are the things that make me really excited. And I want to acknowledge that I know that there are some people who are fearful about that. Then there are people who are worried that our current scientific infrastructure can't continue to exist if we start to think about new models. And I want to challenge you to shed your fear of that scarcity, because there are different and better ways that we can do this. It's just that we're not the ones to figure that out. We are partners in figuring that out.
So I want to pick up on a few points that you just made, Dr. McLemore, and I especially like your talking about failure of imagination, the need for curiosity, and bringing in different perspectives. That's absolutely essential. So how do we create an environment that is welcoming of that curiosity, that is welcoming of different ways of funding research? How do we change the incentives that are driving this?
Quite frankly, I have been encouraged and cautiously optimistic about some recent initiatives that we've seen with federal funders, right? When you think about the Unite initiative addressing structural racism at the NIH, when you think about the first mechanism to diversify faculty and the clinical research and basic science research domains, been cautiously optimistic about that. I would be remiss if I did not make the obvious case to be able to say that there are different pieces of legislation that could assist us with new money, at least in my field, in reproductive health rights and justice, that are essential. I mean, we will never get to health equity if we don't have the purse strings of venture capital, of government, of private philanthropy, right? We need all three. So let's state the obvious there. Not only do we need new dollars, but we actually need to redistribute existing dollars towards health equity frames, right? So we can't continue to fund research where we have a lot of descriptive data and we're looking for spatial and or temporal places where we can intervene, right? At some point, we have to have a really honest conversation about, do we want to continue to fund descriptive work? And I'm not just talking about basic descriptive work like basic science, but even in social science, we have to stop describing things, especially when we have really good evidence. And we need to really start to think about, well, where are the implementation science problems, like or the approaches that can be helpful? What are the partnerships that we need in order to even begin to test those interventions? What are the key time points that we need to be thinking about where those interventions might be helpful? I had a conversation yesterday specific to the intervention of transportation for pregnant capable people. And I sat there and I said to myself, we are thinking about this in the wrong way. I said, I have data that suggests that, for pregnant people, some of them are going back to drive for Lyft and Uber and work in the gig economy and further subjecting themselves to some of the, postpartum complications like deep vein thrombosis or blood clots 10 days after a C-section because they need money. So maybe what we need when we think about transportation is we need a basic minimum income for our citizens so that they can be home bonding with their baby, the co-parent lactation, and not driving around in a car for 8 hours because that's how they generate their income. Maybe we need paid family leave, right? I mean, so part of our science, part of the way we think about, there's a translation piece that those of us who are researchers and clinicians and scientists also, we need to be able to talk to policymakers around why it's so important that we have access to federal purse strings and not just philanthropy, to really be able to upend and to operationalize the descriptive work that we already know, right? We need to move beyond description, and we need to do some interventions research. We need to do some testing of hypotheses, and we need to generate new hypotheses. And we can only do that if we're in partnership with community.
Now, Dr. McLemore, when Academy Health was first established 40 years ago, we were dominated, certainly always, by the social sciences, and we did not have too many clinician scientists and certainly very few nurse scientists who were involved. But that situation is very different now. In fact, nurses were one of the first interest groups that were established at Academy Health, the Interdisciplinary Research Group on Nursing Issues. It's one of our most vibrant and active interest groups. And so as you think about our field, and in particularly nurse scientists in our field, what do you see as the great opportunities for nurse scientists going forward?
I've been a nurse my entire adult life. I've never done anything else for pay, and I love nursing. It is just like, it has been such a gift for me to be able to figure out that this is what I wanted to do. I am really excited to be representative of a group of 81 nursing authors. Actually, we have 81 chapters in a book, but there's actually way more authors in it, who are going to be sponsoring a nurse scientist at the Academy Health meeting this year. It makes me really excited. We don't pay our authors royalties, but what we do is we try to pay it forward to the future of nursing. So we take a proportion of our funds to really create scholarships and fellowships and opportunities for other people to network and engage within the Academy Health research meeting, as well as the educational offerings from the conference. One of the reasons why nursing chose Academy Health and not disease-specific states around where we want to spend our time in professional organizations, and one of the reasons why I like the work that Academy Health does, and is because we've gotten too siloed in our professional organizations, and Academy Health is a place where you can go. It doesn't matter what your domain of research is. It is more about this idea that there are data within health services research that intersect with education and transportation, carceral systems. Like, it doesn't matter if it's in the health services arena or not. It is adjacent to all of the other factors that influence both the positive and the negative social determinants of health. So nursing was very prescient early on to recognize the work that we do, because it's not just about acute hospitals and healthcare systems, right? Only 40% of nurses work there. We work in a whole lot of other places. And so it doesn't surprise me that in 40 years, that there has been a huge interest of nursing in the work that Academy Health does, because it's congruent with how and where we do our work. So I am just excited to be associated with, affiliated with a professional organization that is a home for transdisciplinary work, because that's exactly what nursing science is.
So I want to ask you a question, again, looking to the future. What would you predict will be the most important contribution of health services research over the next 20, 40 years?
Well, I have to say, I think about this in two different ways. I am concerned about the continued decimation of the social safety net. And so, I am really hoping that, at least in my domain, in maternal health, reproductive health rights and justice, that we can at some point get to different provisions of the omnibus and other kinds of policy levers that will assist us to have the important resources that we need on the human services side and not just on the health side. So one important role I see health services researchers having in the future is continuing to document the importance of a strong and robust social safety net, along with a strong and robust healthcare budget, right? That's one piece. Because without it, I think we're going to continue to see the downstream effects of our inability to have upstream investment in health and well-being. So that's one very important piece I see for health services researchers over the next 40 years. But the other thing I do want to be able to see is new methods. You have a crop of new investigators, new researchers that are doing some really important and badass work, right? Who are really developing new tools that we can use in science that I think will be very, very helpful, whether it's how we do our analysis, how we choose our reference groups, how we think about our hypotheses, and even the research questions that we ask, what the data needs are in the future. You've got a whole host of early career people matched with senior researchers who are really disrupting and asking those questions. So I can't wait to see what they come up with methodologically that will allow us to do more complex and at the same time community accountable research. So those are the two places. One is kind of negative and continuing to document the need for a robust social safety net and the impact that that has on human health over time. But the other is really around the excitement that I have of the new measures, the new metrics, the new tools that will be coming out because you have assembled some really brilliant researchers and intergenerational teams to come up with those things that we need desperately right now and in the future.